Hello, children of a lesser joint, and welcome to today's version of Jaw Talk. The last segment, I finished off by talking about arginine vasopressin, and it was part of the manifestations of the endocrine malfunctions that can occur in sarcoidosis. Just to re-emphasize where I'm at for those of you who may have joined me late, I am in a category described by autoimmune diseases, and as a subset of those autoimmune diseases are the granulomatous disorders. I want to take a bit of a step back right now and help you to refocus. And in helping you to refocus, I want to talk about relevance. Why are these topics that I'm discussing relevant? And what I've been trying to show you is that there are many diseases. Now, albeit I've only talked about a few of those since these video segments have started, but I am trying to bring to you a heightened sense of awareness and to elevate both the awareness for the doctors and the patients who are part of this group. And in taking a disease which could be typified by giant cell arteritis, as I've discussed earlier on in this series, or polymyalgia rheumatica, a disease that spins off of sarcoidosis called SAPO, I have taken the symptoms that could be present and matched them with the disorders that occur as part of this group of diseases. So those of you who are seeking attention for a problem will recognize that this could be part of a larger problem, and you may not be getting the care you need in order to solve the whole problem. Even when you make positive strides, unless you've undergone a comprehensive diagnostic examination, you can still make progress and leave the primary diagnoses on the table. I think that is very important, and I will ultimately end up showing you a case where that's exactly what happened to me. I did a great job of resolving the patient's problem in the TM joint, and yet I had a missed diagnosis. I wasn't knowledgeable enough to be able to solve this problem for the patient in bringing him to a better conclusion. So here I have a grouping of diseases, and there are many diseases here, which have joint manifestations and constitutional symptoms, and they present as multi-system disorders with multi-system involvement. And they affect, just to give you some examples, nerve function and muscle function and cellular function. And these disorders also cause wasting of the joints. And so there's structural breakdown of joints causing biomechanical and biophysical property failure, which translates into the tissue and organ structures, and causes inflammatory changes within blood vessels. It affects your immune cell system and your barrier function integrity, like your skin or your intestines, which is our first line of defense against pathogens. So in a disease, for example, like psoriasis, where you end up having skin plaques, and you may be itchy, so you scratch them, and then you open up wounds, and then organisms like staph epidermis can creep in there, get into your blood system and migrate to joints, or you could have a disease like Crohn's disease or celiac disease that do the same thing. And so importantly, at this point, we need to really talk about diagnosis first. Diagnosis comes before your treatment options. How can you reach effective treatment options until you know what's at play here? And that's the residual message that I want to leave you with today, because if you go into a doctor's office and you have a headache, it may not just be your temporomandibular joint. You require an investigation beyond which you may be getting. Most of you will go in to a dentist's office with an expectation, and you'd like those expectations to be met. And where are you getting those expectations from? Most of the time, you're getting them from internet resources. And so you will go to different sites, different group sites sometimes. You will see what your peers have to say, and you almost do this as if you are going to a satisfactory rating review in determining what care you think is best for yourself. Well, I think these days, that might very well be appropriate. But if you look at this without bias, you may not have selected the right approach to receiving your diagnosis. And that's today's discussion. I hope you will join me for the next episode, when I'll be rocking it out with Jaw Talk.